Federal Capital Territory resident doctors resume face-off with federal government over unpaid COVID-19 hazard allowances and other pending issues. African Development Bank President AKINWUMI ADESINA promises helping hand to African countries devastated by the coronavirus. And new rules on the wearing of face masks in workplaces for employees indoors and outdoors come into force in France Labour Ministry to ramp up inspections. Nigeria continues to record lower cases of the SARS-CoV-2 coronavirus COVID-19 with 143 new cases announced by the Nigeria Center for Disease Control, NCDC, and no death in 24 hours. As the country's total confirmed cases passes the 54,000 mark, the center is still calling for vigilance and the necessary safety measures to reduce the spread of the virus. The latest reported cases were reported in 17 states and the FCT, with Plateau State recording the highest number of infected persons at 35, followed by Kaduna State 21, Lagos 19, and other states you can see there on the screen. Now, 125 people were discharged in the last 24 hours in 15 states, 26 in Ogun, 25 were discharged in Edo State, 21 in Plateau, 14 in Kaduna State, 11 in Kwara. The FCT discharged 5 persons, followed by Borno 4, Akwa Ibom 3, Bayelsa 3 as well, Lagos 3 as well, 2 each in Niger, Osun, and Oyo states. Also, Rivers and Sokoto discharged 2 persons each. Lagos, the FCT, Oyo, and Plateau State are managing over 1,000 cases, and Nigeria has tested over 400,000 samples nationwide. Now, Nigeria has tested 405,916 coronavirus samples nationwide, says figures from the NCDC, which also shows that states like Jigawa has not recorded any case in over a month. That's 46 days. Kogi, close to 2 months, 59 days to be precise. Yobe, in the last 32 days, no case. Zamfara in the last 11 days, and 7 days since the last case was recorded in Cross River. Well, joining us to talk about this and ramping up our testing is Dr. Joseph Ajobiwe. He's a medical laboratory scientist, also a virologist. He joins us from Abuja studios. Welcome to the program.
Thank you.
All right. What do you think is happening in some of those states that have listed that we've seen the last case and some over a month?
Can you repeat yourself? I can't hear you.
So I listed a number of states that has taken quite a while to record or confirm any further case. And a number of people have been wondering why indeed those cases have not reported cases. Is it that they're not testing, or what is happening? So we're looking at states like Jigawa. It hasn't recorded a case in over 46 days. And this is talking about reports from the NCDC, Kogi as well. Yobe, in the last 32 days, it hasn't recorded a case. Zamfara, in the last 11 days, Zamfara State. And then we're having Cross River that hasn't reported a case in over a week.
Yeah, it could be as a result of paucity in the testing procedure. Maybe people are tired, they are not going for the test, or they are reluctant.
Talking about what's indeed happening there are several other states as well from the virus curve and the situation reports from the NCDC. States like Kogi, we're seeing Yobe, we're seeing Zamfara. they have no active cases of COVID-19. So as it stands now, no case on admission in those states, Kogi, Yobe, and Zamfara. And then we have states like Cross River that has one case presently on admission, while Sokoto, Jigawa, and Kebbi states have 3 cases each. For some of the other states, it's over 10 cases that are on admission. But what do you think our testing targets should be for each state? The Presidential Task Force has talked about how states need to own up and indeed drive, what it needs to do to prevent the spread, to flatten the curve. So what should be the testing target to meet our 2 million target of testing Nigerians for states?
The testing target should be at least every day. Shouldn't be less than 100 per day. And people should be more interested in coming out, okay, for the test. It's as if people are tired. There should be more awareness created, okay, on the essence of testing. Because testing is very important so as to get those that are infected. Because if you don't create awareness, definitely people will not come out. So we need to intensify awareness creation so that people can come out.
Some experts have suggested maybe more incentives. Some have even said before full resumption of schools, we should have all the teachers, all the students tested as well. Do you agree?
Definitely. And there should be something done too, okay? Not just testing these people. Even those people doing the test, you need to encourage them. Because for some times now, the government promised to palliate those people that are doing the test, but up to now, it's just fake promises. Okay, they are not assisting the people doing the test. So these are the people to create the awareness. You need to energize them. You need to pay them what is due. When you pay them, definitely they will even promote the awareness themselves.
Finally, looking at the action plan, seeing as we are indeed fighting this pandemic, compare Nigeria to what other countries, even in Africa, are doing. Where would you say, what advice would you be giving to the Presidential Task Force moving ahead?
Yeah, the advice I will give is that they should also look at alternative means of combating this disease. There are local means available for combating the COVID-19 disease. For instance, there are lipids that you can use to combat the disease. There are ionizing radiation that you can use in ambient environment that can finish the virus. So the idea that the virus has no solution is a fallacy. There are solutions, and we have used this for several patients, and it worked. So I don't know why people are saying there are no solutions. Students are going back to school, pupils are going back to school. We need to give them something that can protect them against the infection. This virus is not unsurmountable. We can fight the virus. Thank you.
Thank you very much for joining us on the program. We've been talking to Joseph Ajobiwe, a medical laboratory scientist and virologist. Thank you for joining us on the program.
Thank you.
Now, the president of the African Development Bank, Dr. AKINWUMI Adesina, says that he would do everything necessary to lift African economies out of the severe devastation caused by COVID-19. He was speaking today in Abidjan, Côte d'Ivoire, after taking and signing his oath of office as president of the African Development Bank for another 5 years, having received the unanimous vote of all the governors of the bank.
The COVID-19 pandemic has changed everything globally. It has thrown Africa's growth back. The continent has logged gains and economic growth that were achieved over the last decade. Africa's recovery will therefore be long and challenging. Now, we must help Africa build back boldly, but smartly, paying greater attention to quality growth, especially in the areas of health, climate, and the environment. As we look to the future, working with the boards of directors, the bank will pay increased attention to supporting Africa with quality health care infrastructure and building on its comparative advantage in infrastructure. The bank's infrastructure work will focus on economic infrastructure, quality physical infrastructure, the health infrastructure. Let me assure you, the bank will play a greater role in policy dialogue with countries. We will support sustainable debt management, boost green growth, and accelerate the provision of jobs for youth on our beloved continent. In our time, Africa must shine like the brightness of the sun.
Resident doctors in Nigeria's capital, Abuja, have begun an indefinite strike over the non-payment of COVID-19 hazard allowances and other related inducements promised by the government. A statement signed by the president of the Association of Resident Doctors, the FCT chapter, notes that the decision to down tools became necessary after several failed attempts to resolve the impasse. The doctors are insisting that they will only get back to work after the various payments demanded are made to their members' accounts. The FCT, with over 5,000 confirmed cases of COVID-19, second to Lagos, is at the list of high-burden states. As at today, it has the highest number of active cases at 3,583. The Adamawa state government has expressed displeasure with proprietors of private schools for reopening primary schools without the consent of the state's Ministry of Education. The Adamawa State Commissioner of Education and Human Development says this during a meeting with officials of the state chapter of the National Association of Proprietors of Private Schools in Yola, the Adamawa state capital.
For 6 months, schools nationwide have been closed due to the COVID-19 pandemic. Now things appear to be looking up in the education sector as the federal government has allowed secondary school students in exit classes to return for their final examinations. In Adamawa State, however, private primary schools have been operating for a month and are even preparing for national examinations into secondary schools. This meeting at the conference hall of the State Ministry of Education is taking place between the state government and the executives of the National Association of Proprietors of Private Schools to correct the anomaly.
It's already an accident that the pandemic has affected all the nations of the world. But we can, with the trust that the schools can guide children, behaving, and also maintain the social distance.
The chairman of the Adamawa State chapter of the National Association of Proprietors of Private Schools assures of compliance by members, while the State Commissioner of Education insists that the COVID-19 guidelines must be followed by all stakeholders.
The National Policy on Education did not state that primary 6 should write any common entrance. That's what we explained to them. It is all about automatic promotion. No one is demoted. So that's not an excuse as far as we are concerned. COVID-19 is the excuse. We are here to obey guidelines according to the Ministry of Education on COVID-19.
As the students wait for the go-ahead to return to school, there are some concerns. Are the schools ready to put all NCDC protocols in place? Are the students themselves enlightened about the COVID-19 pandemic? In the coming days, any gaps will be apparent, and relevant authorities should be prepared to wade in and close those gaps.
When we return, how much testing is ongoing at the Just Correctional Centre? We have that story and more when we return. Welcome back. We continue in Plateau State, where authorities at the Jos Custodial Center of Nigerian Correctional Service are not taking chances in ensuring that the coronavirus does not spread among inmates at the 6 centers in Plateau State. According to the state controller of the service, Mr. Samuel Aguda, 57 samples of inmates were taken for testing and 10 who tested positive have been taken to isolation for treatment and are back at the center after treatment.
Only lawyers, so that their cases will be disposed of in time. They allow lawyers to come, and whenever they come for visiting, social distance is always maintained. So the lawyer will not be allowed to be closer to the image, to his client. And he must mask, put on the hand glove, hand washing, sanitizing of hands also must be observed.
Dr. Ejike Oji is the Chairman Medical Subcommittee of the FCT's Ministerial Expert Advisory Committee on COVID-19. He joins us from Abuja studios. Thank you for joining us on the program.
Thank you very much.
I'd like to begin with what we're seeing from the FCT, the daily record of cases. However, the numbers are low. Is it safe to say the FCT, with its testing capacity, both public and private, that the virus is abating?
Yes, the testing resources have been completely ramped up here in Abuja. Apart from the public sites, some private centers have also started testing in Abuja. Remember that the federal government is going to open up the country's airway, and then passengers of interest needs to be tested. So the PTF has encouraged private sector to open up their doors for testing. So testing has actually gone up in Abuja as opposed to what we had before in terms of numbers. So more people are being tested. But yes, from what we're seeing, it appears that the ones that are showing positivities are not as much as it was before. But it doesn't mean we should drop our guards. If from the projections we've seen, the cases seem to be coming down. But this is the time to double up so that we won't have a second wave if truly that they are coming down.
Talk to us about the virus incubation, especially about the standard to detect COVID-19. Some people are recovering after just 6 days in isolation, while for some others it's taking them longer, even longer than 20 days. And this is one of the reasons why a number of people believe that maybe the virus isn't real after all.
Yes, remember that this virus obeys all the 3 rules of engagement. One is the viral load, when it affects the person. The second is the route of transmission. And then finally, the immunity level of the patient or the host. So let's start from the immunity. So if the patient is exposed, the immunity level of the patient can make 2 things happen. One, the person might completely fight off the disease and the person won't have the disease. Or the person will get the disease and will be asymptomatic or to mild. And of course, if the person's immunity level is not so good or the viral load is very high, it will overwhelm the patient and the patient will eventually have moderate to mild to severe symptoms. So, so it depends. It's not standard. We wouldn't say that a cutoff point is 10 days or 5 days or 4 days for every patient. So what normally happens, and then when people are tested, you don't know when the person was infected. You don't know when the body started fighting the disease, and then there is a shedding of the virus. So at the point of test, the outcome of the person getting negative further down the line is what will determine whether that person is infected or not. So what I mean by that, if let's say for purposes of explanation, is a 10-day period that you stay to get negative for a particular person. If you tested the person by the 5th day of being exposed and now has gotten the disease and is supposed to have been positive, if you test on the 5th day, it doesn't mean that the test has to, the person has to say 10 days to test negative. So if you test that person 5 days later, the person is going to test negative. Initially, before the understanding of the virus was very well known, what normally happens after the first test, the patient stays for 10 days or so, and then a second test is administered. And when the second test is administered, another 48 hours is given if it is negative to retest the patient. If it is now negative, then the patient is discharged. But nowadays, once the first test is done and it's negative, the patient is allowed to go home and continue to self-isolate for some time. So it doesn't really mean that somebody converted after a few days after being found positive that there's something different. It's just about the time the person was caught and his body and his blood was, his samples were taken, and then whether to know whether he's positive or negative.
All right. We appreciate your time. Thank you so much, Dr. Ejike Orji, Chairman, Medical Subcommittee of the FCT Ministerial Expert Committee on COVID-19. Thank you for joining us on the program.
Thank you for having me.
Now, new rules on the wearing of face masks in workplaces has come into force in France. The general rule on compulsory mask wearing concerns anyone working in shared indoor workspaces, but the protocol also affects employees working outdoors. Both the private and public sector are concerned, and the Labour Ministry said it will ramp up inspections to ensure compliance with the new rule. Here's more on the global update.
Children returned to school on Tuesday in the central China city of Wuhan, the original epicenter of the coronavirus epidemic that underwent months of lockdown, but which has not seen new cases of local transmission for weeks. State media reported 1.4 million children in the city reported to 2,842 kindergartens, primary and secondary schools as part of a nationwide return to classes. Similarly, in France, 12.4 million children are heading back after a very long summer break. President Emmanuel Macron says the challenges are numerous, but he has appealed to everyone to adopt the same responsible approach as they have for months. Meanwhile, new rules on the wearing of face masks in workplace come into force in France. Hong Kong has started mass coronavirus testing under a new scheme backed by the Chinese government. The voluntary mass testing is being conducted with the help of medical staff from mainland China. A health workers union has criticized the effort as an inefficient waste of resources, while activists have said it could be used to collect DNA samples.
Now, over the course of the last...
Authorities say inmates at a high-security Australian prison lit fires, smashed windows and flooded their cells with water on Tuesday after a lockdown sparked by the coronavirus outbreak resulted in a shortage of staff and services. The unrest began a day earlier at the Arthur Gorey Correctional Centre in the city of Brisbane, 4 days after the local media said the prison went into lockdown due to 2 staff testing positive to COVID-19. The authorities say a shortage of replacement staff, while existing staff stood down to get tested for the virus, had resulted in problems delivering basic services like meals and medication.
Take a look at our website, channelstv.com. It has more updates on the pandemic coming in from Nigeria, Africa, and the rest of the world. channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.